Hi, I'm Dr. Emily Carter. A few months ago, a 52-year-old patient came into my clinic with a simple question. Doctor, I've been eating 4 eggs every day for breakfast. My neighbor told me I'm destroying my heart. Should I stop? He looked genuinely worried. He wasn't overweight. He exercised. His blood pressure was stable. But the word cholesterol had scared him. And here's the truth. Eggs have been feared for decades. Cholesterol, heart disease, blocked arteries, but nutrition science has evolved. So today, I want to walk you through something very specific. What actually happens inside your body if you eat 4 eggs every day? Not 1, not occasionally, 4 every day. We'll talk about cholesterol and heart risk, muscle maintenance, brain function, liver health, hormones, weight regulation, inflammation, and what changes after 40. This is not about trends. This is about physiology. Let's start with something basic. What is actually inside 4 eggs? 4 medium eggs contain approximately 24 to 28 grams of complete protein, around 20 grams of fat, roughly 740-800 millimolar of cholesterol, choline, vitamin D, vitamin A, vitamin E, B vitamins, selenium, lutein, zeaxanthin. And here's what matters. Egg protein is complete. It contains all 9 essential amino acids. Not all protein sources do. When you eat 4 eggs, you're giving your body a highly bioavailable protein source, meaning your body can absorb and use it efficiently. Historically, egg protein was used as the reference standard for measuring protein quality. Now let's address the elephant in the room, cholesterol. 4 eggs contain roughly 740-800 milligrams of cholesterol. For years, dietary guidelines suggested limiting cholesterol intake strictly. But here's what modern research shows. For most healthy individuals, dietary cholesterol has a much smaller impact on blood cholesterol than once believed. Your liver produces cholesterol daily. If you consume more from food, your liver often compensates by producing less. This is called endogenous regulation. In many people, eating eggs does not significantly raise LDL, bad cholesterol, may increase HDL, good cholesterol, may shift LDL particle size toward larger, less harmful particles. Now, there is nuance. Some individuals are hyper-responders. If you already have familial hypercholesterolemia, poorly controlled diabetes, advanced cardiovascular disease, you need individual guidance. But for many healthy adults, eggs are not the villain they were once portrayed to be, especially when eaten within a balanced diet. But cholesterol isn't the only thing that changes when you eat 4 eggs daily. Let's talk about muscle. After 40, something subtle begins to happen. Muscle mass gradually declines. This process is called sarcopenia. Without resistance training and adequate protein intake, muscle loss can average around 1% per year. That might not sound dramatic, but over 10-20 years, it adds up. 4 eggs provide roughly 24 to 28 grams of high-quality protein. That's close to the optimal protein dose for stimulating muscle protein synthesis in one meal. Why does that matter? Because muscle is not just about strength. Muscle regulates blood sugar, supports metabolism, protects bones, influences longevity. Many adults underconsume protein, especially at breakfast. Replacing a carbohydrate-heavy breakfast with 4 eggs can significantly improve morning protein intake, and that may help preserve lean mass, improve metabolic flexibility, reduce mid-morning hunger. But eggs don't just affect muscle. They affect the brain in a very specific way. If there is one nutrient in eggs that almost no one talks about enough, it's choline. 4 eggs contain roughly 500 to 600 milligrams of choline. That is close to, or even exceeding, the daily recommended intake for many adults. Why does this matter? Choline is essential for acetylcholine production, a neurotransmitter, memory and learning, muscle contraction, liver fat metabolism, cell membrane integrity. Acetylcholine plays a major role in focus, attention, and cognitive clarity. Some patients tell me after increasing egg intake, "I feel more mentally sharp in the morning." Now, that's not because eggs are a stimulant. It's because they provide building blocks for neurotransmitter synthesis. Choline intake in modern diets is often lower than ideal, especially in people who avoid egg yolks. And here's something important. The majority of choline is in the yolk. When people eat only egg whites out of fear, they remove the most nutritionally dense part. After 40, cognitive resilience becomes more important. Nutrient density matters more than calorie counting. Eggs are one of the richest dietary sources of choline available, but the brain isn't the only organ that benefits. Let's talk about the liver. The liver processes fat, it regulates glucose, it manages cholesterol production, and it depends heavily on choline. When choline intake is low, fat can accumulate more easily in liver cells. This contributes to non-alcoholic fatty liver disease, which is extremely common. Estimates suggest that 25 to 35% of adults may have some degree of fatty liver, often without symptoms. Choline helps export fat from the liver. So ironically, avoiding egg yolks out of fear of cholesterol may reduce one of the best dietary sources of a nutrient that helps prevent fat accumulation in the liver. Now, eating 4 eggs a day alone will not reverse fatty liver, but in the context of reduced sugar intake, stable blood glucose, adequate movement. Eggs can support hepatic metabolism, and here's another nuance. Dietary cholesterol does not automatically translate to fatty liver progression in healthy individuals. The liver produces cholesterol continuously as part of normal physiology. The bigger drivers of fatty liver are excess fructose, excess refined carbohydrates, chronic overnutrition, sedentary lifestyle. Eggs are not metabolically equivalent to soda. Now, let's move to something many people care deeply about: weight. 4 eggs are highly satiating. Protein increases satiety hormones like peptide YY and GLP-1. Fat slows gastric emptying. This combination creates prolonged fullness. Compare that to a typical breakfast: cereal, toast with jam, sweetened yogurt, pastries. These foods cause rapid glucose spikes and drops, which lead to hunger again within hours. Several studies comparing egg-based breakfasts to carbohydrate-heavy breakfasts show improved satiety, reduced caloric intake later in the day, more stable blood sugar, less snacking. Eating 4 eggs in the morning may reduce mid-morning cravings, stabilize afternoon energy, lower impulsive eating. Now, if you add 4 eggs on top of an already high-calorie diet, weight gain can occur. But replacing processed breakfast foods with eggs often improves appetite regulation. After 40, appetite regulation becomes more sensitive to insulin patterns. Stable protein intake early in the day can reduce metabolic chaos, which brings us to something related: hormones. Cholesterol is not just something that clogs arteries, it is a building block for hormones. Your body uses cholesterol to produce testosterone, estrogen, progesterone, cortisol, vitamin D. Extremely low-fat diets can negatively affect hormonal balance in some individuals. This is especially relevant in women entering perimenopause, in men experiencing gradual testosterone decline. Now, eating 4 eggs daily will not magically increase testosterone, but providing dietary fat and cholesterol within reasonable intake supports normal hormone synthesis. In fact, some studies suggest that very low dietary cholesterol intake may reduce testosterone levels in certain contexts. Again, nuance matters. If someone has severe cardiovascular disease, Their dietary approach must be individualized, but in metabolically healthy individuals, moderate egg consumption does not appear to impair hormonal balance. Now let's address something visual: eye health. Most people don't associate eggs with vision, but they should. Egg yolks contain lutein and zeaxanthin, two carotenoids that accumulate in the retina. These compounds help filter blue light, reduce oxidative stress, protect against age-related macular degeneration. After 40, retinal protection becomes more important. Vision changes gradually. Oxidative stress accumulates. Now here's something interesting. Lutein from eggs is highly bioavailable. Why? Because it's naturally packaged with fat. Fat enhances carotenoid absorption. Some vegetables contain more lutein per gram, but absorption can be lower without fat. So eating 4 eggs daily significantly increases your intake of these protective compounds. This doesn't mean you should rely only on eggs for eye health, but they contribute meaningfully. Now let's talk about inflammation. This is a controversial topic. Some people claim eggs are inflammatory. The reality is more nuanced. In healthy individuals, eggs are not inherently inflammatory. In fact, they contain nutrients that may reduce inflammation indirectly by improving metabolic stability, increasing satiety, supporting muscle mass, reducing ultra-processed food intake. However, context matters. If someone eats 4 eggs daily, alongside processed meats, with refined carbohydrates, within a high-calorie inflammatory diet, then the overall pattern may still be inflammatory. But eggs themselves are not equivalent to processed junk food. Some studies even suggest eggs may improve markers of HDL and antioxidant status. Now, there are individuals with specific sensitivities or allergies. For them, eggs may trigger symptoms. But for most metabolically healthy adults, moderate egg intake does not increase inflammatory markers significantly. Now let's address dosage. Is 4 eggs too many? This is where people get nervous. 1 egg feels safe. 4 feels excessive. But physiologically, the impact depends on your total diet, your metabolic health, your genetic cholesterol response, your activity level. Research has shown that even 3 eggs daily in healthy individuals often does not worsen cardiovascular risk markers. 4 eggs provide about 28 grams of protein, significant choline, substantial micronutrients. The key question is not just how many eggs, it's what are you replacing? If 4 eggs replace sugary breakfast cereal, pastries, processed meats, sweetened drinks, the net metabolic effect is likely positive. If 4 eggs are added on top of an excessive caloric intake, weight gain can occur. Calories still matter. Energy balance still exists. But eggs are nutrient-dense calories, not empty ones. Now let's address who should be cautious. While many healthy adults can tolerate 4 eggs daily, certain groups should approach this thoughtfully. 1. People with familial hypercholesterolemia. Genetic cholesterol regulation disorders may respond differently. 2. Individuals with poorly controlled diabetes. Glucose control must be prioritized. 3. Advanced cardiovascular disease patients. Individual dietary planning is essential. 4. Egg allergy. Obviously, eggs are not appropriate here. For most metabolically healthy adults, however, eggs can be part of a balanced diet. But balance matters. Vegetables, fiber, healthy fats, movement. Eggs are not a miracle. They are a tool. Final integration. What really happens? If you eat 4 eggs every day, let's summarize clearly. If you eat 4 eggs daily, you may improve protein intake, support muscle maintenance, increase choline for brain and liver, improve satiety, stabilize morning blood sugar, increase intake of lutein and zeaxanthin, support hormonal building blocks. You will not automatically clog your arteries, instantly gain weight, destroy your heart, but context determines outcome. Eggs in a processed diet are different from eggs in a whole food pattern. After 40, nutrient density becomes more valuable. Muscle preservation becomes more important. Metabolic stability becomes essential. Eggs can contribute meaningfully to that. If you're curious, try this. Replace your typical breakfast with 4 eggs for 2 weeks. Observe energy, hunger, mental clarity, weight, digestion, and if you have concerns about cholesterol, test before and after. Data is more useful than fear. If this video helped clarify the confusion around eggs, let me know in the comments. How many eggs do you eat daily? And have you ever avoided egg yolks out of fear? I'll see you in the next video.